We're on.
Hello everyone, we might get started with this webinar. So my name's Rachel Sutherland. I work at the University of Newcastle in the world of physical activity and nutrition.
Hello everyone, we might get started with this webinar.
Sorry, yep.
So welcome to all of you to the webinar titled Implementation Science Learnings. And I'd particularly like to welcome my fellow panelists and discussant, Professor Patty Jean Naylor, and also 3 early career researchers sharing their real world experiences of physical activity implementation in the real world. So Mary Kennedy, Tepi McLaughlin and Sam Kassar.
Just clicked on the mouse, I think.
So before we get started, as an early career group at ISPA, we've been mixing the webinar format up a little bit. So today we're going to feature some questions live via the Q&A section. We're also going to integrate some polls to make it a little bit more interesting. Our webinar format's going to go for 30 minutes in total, so it's going to be nice and short and sweet. And we'll also be emailing you a feedback survey at the end, so you can give us any suggested features and formats going forward. So today's order of events, we're going to have Mary speak to you first, then Tepi McLaughlin and our third speaker, Sam. Each speaker is going to be presenting for about 5 minutes about the project that they're working on. And then we're going to collate the Q&A questions that come through that you can all send in and discuss those at the end. Just a quick plug, if you'd like to look at our past webinars, if you sign into ISPA or ISBNPA website, then go into the free webinars, you'll be able to see all of the past webinars that we have conducted. And they're just sitting all there in that little section under webinars. So going forward, I'd like to introduce Mary for you, and we're going to start with a quick poll. So it should pop up on your screen now. So what we'd like to ask is, what role are you in? So if you could just quickly give us an idea of the role that you're in at the moment, be it student, an early or mid-career researcher, a senior researcher, practitioner, policy maker or other, so we can get an idea of who we're speaking to.
All right, 10 of 42 have come through so far, so we'll give it a few more seconds. Okay, we'll end it there. So there's your spread.
So it looks like we've got a good mix of students and early career researchers and a few mid-career researchers, senior researchers and policymakers thrown in there, which is great. And in terms of rating your own knowledge in terms of implementation science, it looks like we were sort of in the middle. So we're not novices, but we're not extremely knowledgeable. So we hope that today's presentations will add to your knowledge around implementation science, particularly in the field of physical activity interventions. Okay, Mary, I'm going to hand over to you.
All right. So I'm really excited to kick off this webinar. Thank you for being here today. I'm going to share with you an example of the RE-AIM evaluation framework in practice. So just to get started, a very simple way to think about evaluation is it's an ongoing effort to answer the questions, is what we're doing working, why or why not, and how do we know? A framework gives you a systematic way to answer these questions so that you can make judgments and work to improve your program going forward. So I'd like to know from you, what evaluation frameworks do you have experience using, if any at all?
All right, so the answers are coming through. We'll give people a few more seconds. 20 of 46 so far. A few more seconds there. Last few coming through. 3, 2, and 1. End polling.
Fantastic. So RE-AIM, so a lot of you are familiar with the RE-AIM framework, which is great. And so I can really spend time talking about how I used it for my project. So I'm working at the Exercise Medicine Research Institute at Edith Cowan University. And about 5 years ago, the team at Emory wanted to help overcome the challenge of trying to get patients to exercise during cancer treatment. And they partnered with a private oncology clinic, Genesis Care, to actually open an exercise facility within the cancer treatment facility itself. The concept was it would give the oncologists a clear referral pathway, and it would give patients a place that they knew they could trust and was logistically easy to manage while they were receiving daily treatments. After 4 years, they had done some health outcomes research and found out that the program itself was very effective at improving patients' health. But what they didn't understand really was how well was the overall mission working. So we set out to answer the question, is this co-located model effective at increasing access to exercise for people receiving treatment at Genesis Care? Because that's really the overall goal, was to facilitate exercise for more patients. So we use the RE-AIM framework, and I know many of you are familiar with it, but for those of you who aren't, each of the letters stands for a different construct of the framework. So reach, did I reach the target population? Effectiveness, was the intervention effective? Adoption, was there organizational support for it? Implementation, was it delivered properly? And maintenance, can it maintain over the long term? The reason that we chose RE-AIM is, first, it's got quite an evidence base in D&I research. So we knew that we were looking at issues around implementation, and we wanted to be able to be sure that we captured those. Next, there's quite a bit of flexibility within each of the constructs. So we were able to take the concept of, say, something like reach and make sure it was really suitable for our context, so we could be clear about the questions we were answering. So I'll just share with you how we applied the RE-AIM framework to our project. So for reach, we wanted to know the number, proportion, and representativeness of the people who participated in the exercise clinic. So we asked 2 questions. How many people participated in at least one exercise session at the clinic, compared to how many people received treatment at Genesis Care overall? And then what were the key demographic and health issues with the exercise program participants? And I apologize for my dog, just trying to get involved in the webinar here. Next is effectiveness. So patient satisfaction with the exercise services. How satisfied were exercise participants with the program? Adoption. What was the integration of the exercise facility into care for patients at oncology? So how many oncologists and nurses participated in referrals to the exercise clinic? Implementation, we wanted to know about the consistency of delivery of the program. So did the program structure remain consistent? And was there a clear and consistent method of referral? And then finally, maintenance. To what extent was the program part of routine organizational practices, and what challenges needed to be considered to keep the program in place? We answered these questions through a variety of surveys, focus groups, key informant interviews, and data from the clinic itself. And what we were able to see using this RE-AIM framework is we got to see a comprehensive assessment of the program. So it wasn't just one factor or another. We could see the big picture of what was working and what wasn't. We were able to distinguish between issues of implementation versus issues of programming, which was really critical for us. And finally, it provided a roadmap for next steps. So as we worked to improve the program, we could really prioritize based on our findings from the RE-AIM framework. So there's a lot more I could share with you, but in this rapid fire format, we'll leave it at that. There's some resources here. The RE-AIM website's fantastic. Dissemination implementation is great to learn about other evaluation frameworks. I acknowledge and thank my project supervisors and the partners that allowed this research to work. And here's my contact information. Please reach out if you have any questions.
Excellent. Thank you, Mary. That was really good. I'm next, so I'll start sharing. All right. So I'm going to talk about a case study of a school physical activity program and about tracking modifications to the implementation support provided in real time. I'm going to use this as a case study, so I do need to give a little bit of background about that. But I'm going to start up with a poll. So let me launch this one for you. So you should see that on your screen now. So we're looking at the scale-up penalty. And between the pre and post-scale trials, from this particular review, what do you think the scale-up penalty would be? So that is the difference in effectiveness between the two trials. Okay, so it looks like roughly about 20 people have completed it, or 50. I'll give it a few more seconds. All right, so here's the results. Most people have gone conservative and sorry, the opposite way, have said there's actually quite a big scale-up penalty of 55%. This review found 75%. So the post-scale trial was only 75% as effective as the pre-scale. So building on that, wanted to know the reasons for that scale-up penalty. So I'm going to start with a case study of physical activity for everyone. This is a secondary school physical activity program delivered originally in 5 schools. It's multi-component, and it was found to be effective for physical activity, but also for unhealthy weight gain, and it was also deemed cost-effective. So we said, let's scale it up because we're only one of very few effective physical activity randomized controlled trials in secondary schools. Originally, it was just delivered from the base of one health district. So it was delivered wider than that, but it was centrally controlled from one health district. And you can see there the map of the UK and the highlighted health district. So you can see just roughly the scope and size of this project was delivered across a vast geographic area. So there's it in a little bit zoomed in. There's Hunter, New England, where it was originally developed from. We then decided during the scale up that we'd bring on other delivery partners. So that was other local health districts. So there's 3 additional health districts to help deliver the program. So this is what the scaled up trial looks like. And it involves the inner ring, which is the green boxes, the 7 physical activity practices, what we're trying to get schools to do, and the 7 implementation support strategies around the outside. And these remained consistent with only few modifications between the pre and the post scale. So there's the practices and strategies. So I want to think in the next poll about the possible reasons for why we might see a scale-up penalty. If we've not changed the program too much, what are the reasons that could be? So I'll launch that one for you. So I'm asking what could possibly cause this scale-up penalty between pre and post-scale trials. So I can see the results coming in live, and most people are kind of going the way I wanted them to, so that's good. Most people saying all of the above. I'll give people a few more seconds. All right, so you can see there that about 80% of people are saying all of the above. So it's differences in the fidelity of the delivery of the implementation support strategies, differences in the reach of the implementation support strategies, so those the schools receive and uptake, and also modifications to the implementation support strategies. That's the one that I'm going to focus in on here, and a method that we use to monitor modifications. So the scaled up trial, 2017 to 2019, 24-month randomized controlled trial in 24 intervention schools. So 5 times as many as the original, spread out a lot further. So in the process evaluation, we asked what modifications to the program occurred during the delivery to the implementation support strategy. So that outer ring of the diagram. We use the framework as a framework to record adaptations in real time. So we use the group consensus method monthly. And I'm going to just walk you through the practicalities of how we've actually used this framework. You may not have heard of this framework before, but we found it quite useful. But we did have some learnings along the way. So just a bit of background, defining adaptation as a form of proactive modification. So something that you deliberately want to do. And then modification is a broader concept. It may be a reactive change, maybe something's happened, staffing changes, all sorts of reasons why it could be reactive. So this is the framework then. So starting in the top left-hand corner, we looked at all of these boxes and the codes underneath. So when did the modification occur? So we were looking at during the scale up. So during the implementation, sorry. And then, so all of our modifications were during the implementation when we were recording them. We were asking, were the adaptations planned or reactive? Who participated in the decision to modify? So was it made by us? Did we decide that we were going to change the program during delivery? Or did the schools that took part decide that they needed things in a different way? The goal of those changes, and then eventually the content of what was modified. So was it to the context, to the training, or to the content of the actual delivery? Or is it to facilitate implementation scale-up activities? At what level of delivery did it occur? Context modifications have additional questions. The reasons, there's many reasons there, and we put some of our own ones in. What is the nature of the content modification? So was it just minor things like tearing or tweaking, or was it something that was departing from the intervention, something completely different? And there's multiple codes there. A really important one, so was it subjectively determined to be fidelity consistent, or was the modification fidelity inconsistent to the implementation support strategies? So we practically did this in a monthly consensus meeting. So here's a screenshot of how we actually went through. So month on month, we recorded the date and went through a list on the left-hand side of all the boxes from the framework. And we consensusly came up with all of the codes. So we went through each of the ones on the left-hand side. We didn't find that process to be too arduous. And the kind of results that we're getting from that, we'll be able to say kind of what were the majority of the adaptations? Were they all made by us, or did they apply across all schools? So we want to try and understand that scale-up penalty and the reasons for the differences we might see. And so it's important to track those modifications that might occur during delivery, as well as those that are documented between the two trials as well. So there's references. I'll flash those up if anybody wanted them on the video afterwards. It'll be on YouTube. And just to acknowledge everybody in that team and the funders. Thank you very much.
That's great. Thanks, Teppy. We might switch over to Sam now to be the third presenter.
Great, cool. We'll start with my screen sharing. Just one sec. Can everybody see that? Let's hope so. All right, so I'm going to have a chat a little bit about our dissemination of an intervention that we've got going here at Deakin University. I'm going to give a little bit of a brief introduction on sort of the practices that we've been going through and what we've learnt to date over the first, I guess, year and a half since we launched. So we'll start off with a poll. I guess it's interesting for me to get a sense of everybody's experience with dissemination strategies, just to sort of figure out how we're all tracking. If we can get that one up on the screen, that'd be good.
Okay, so nobody's voted so far. Everybody's probably reading all of the different boxes. We'll give people a few seconds to read those. We won't rush this one just as much. Okay, we'll give it maybe 5 more seconds. All vote now. Okay, there's your results.
Great. So I guess that's probably similar to my experience and our team's experience before we got underway with this project, which I'll share with you in a second. And I guess a lot of us in the research world are publishing papers, and that's been our experience of dissemination. I'm going to share with you a few strategies that we've taken to, I guess, go a little bit further than that, and what we're planning in the future and how that's worked so far. So just to get everybody on the same page, I guess I want to share what we're terming dissemination. And basically, we're talking about planned and proactive strategies to increase the reach of an intervention. So it differs a little bit from diffusion, which you might have also heard, which is sort of passive. And we know that that can be a little bit difficult because it relies on individual behavior change to adopt or start implementing some of these programs. So we really want to be talking about active dissemination strategies, and that normally that would be planned and proactive. That's what we're going to focus on for the day today. So as a case study, I'm going to talk about the Transform Us program. It's a school-based intervention that's been proven effective in a large-scale RCT a few years ago. We're now scaling it up across the state of Victoria. In Australia, we've got roughly 2,000 primary schools who are able to sign up to the program. It's a free program, which you can see here on the screen, looks at a whole school approach and is multi-component. So that's the intervention we've been trying to disseminate, and we're hoping as many schools around the state as possible will be signing up. If you're interested, jump onto the website to have a little bit more of an idea. So we're lucky enough to have 16 different partners. They cover all different levels of the education and physical activity system. We've got teacher and principal associations, we've got educational boards, we've got professional sporting clubs, we have government departments of health, education and sport, and we also have peak public health advocacy organisations. So they're on board and helping us to promote the program. And to do so, we have put together a dissemination plan, which we've sent out to each of those partners. So like I said, we've been going for about a year now, or a little bit over a year. And late last year, we reached out to them and had some phone interviews with each of our partners and basically said, how's it going with your dissemination, and what do you need from us to make your lives a little bit easier in terms of sharing this information with your connections and with your audiences. So we've customized each of these resources for each of the partners, and I'll share a couple of these on the next screen. So on the left there, you'll see an informational flyer that we've sent out, and then on the right, we've got an active break for teachers. And so that's just a few of the resources that come in this dissemination toolkit. We also have informational articles, we have case studies, we have further infographics, we have PowerPoint slides because some of our partners mentioned that they give presentations every now and again, so we've prepared them. We have recruitment emails, and we have a bunch of pedagogical tips that teachers can use if they decide to sign up to the program, or at least to give them an idea of what the program involves. So we wanted to know how our partners have actually been disseminating the program so far, and it turns out that they've had quite a few attempts and through different means and methods. So a lot of them are using e-blasts to their members, and that might be going to schools or to teachers directly. They've been using social media via tweets and retweets, which has been great. We've had conference workshops, presentations, and we've been at trade stands for a few of the physical education teacher conferences, which has been really good. And we've also heard from our partners that they've had direct discussions with teachers about the program as well. One of our partners is putting out a tip of the week for teachers, and part of that is included in Transform Us content. And there's also newsletters that are going directly to the health and PE teachers within the schools, who we know are often the champions of these sorts of programs. There's also finally been informal discussions, and that might be through panel meetings or just regular communications within their networks. We'll jump into the second poll, and I guess this is a journey for us, and I assume for everybody else listening. We're interested to know how things might have gone wrong in the past for you, and I'm going to share some of our learnings on some of these on the next slide.
So I think people are reading the boxes again and just getting familiar with those. So 10 of 53 through so far. I'll give it a few more seconds. I'll give it 5 seconds, say. Okay, and I'll end the poll in there. There you are. Okay, interesting. I guess the first one there at the top there has been my experience so far. So this is all a learning curve for us. And I'll share with you now on the next screen some of the things that we found out from our partners and what they've told us that we can probably improve on to continue to disseminate effectively and move that forward. So we heard from them that basically they're expecting regular communication, and they're expecting that the research team actually leads this data sharing and communication. So we've put together a quarterly partner project update where we share, I guess, any new updates on the program or any data that's come in so that they can then pass that on to their networks. We spoke about the fact that there's real opportunities for cross dissemination. So a lot of our partners are also doing other programs, and where possible, we also try to highlight their work. And that gives them a chance to link in and talk about how we can, I guess, go for a whole of day approach and not only focus on school activity, but activity across the board for our kids. We've put together a dissemination toolkit, which I showed you earlier, and that, I guess, gives them the content that they need to then pass on. We had quite a lot of information about the actual targeted dissemination, so our partners reach different areas of the system, and part of that means that we need to have content for each of those. So, for example, we were told that case studies are going to be quite persuasive for schools who are thinking about signing up to this program, so giving them examples of how it's worked in the past successfully in other schools is really great. And it's really important that we also talk about the types of messaging we do. So we've heard that teachers are going to be more likely to sign up to a program if we message around behaviour management and concentration gains from programs such as this. And if we're targeting school leaders, then it's important that we talk about government targets for activity levels.
and that we talk about overall academic achievement. So trying to talk in their language and I guess think about the ways that they're motivated to sign up to these types of programs. We've also put together a dissemination report, so we share that with our partners on a quarterly basis as well. And we're hopeful that that'll help with accountability on their side. And we're also testing the effectiveness of all these different strategies, but don't quite have time for that today. So if you're interested, reach out and we can have a chat about that. And then I guess finally, interesting for us was the importance of staff turnover. So often we hear about that in implementation science on the end of the implementers, but actually we heard from our partners that staff turnover on our end in the research department had a little bit of an issue when it came to the momentum. So just be aware of that if you are disseminating, that if there are any staff changes within your team, to also communicate that as you move forward. So if this has piqued the interest of anyone and they're in a situation where they have an evidence-based program and they're trying to increase the reach, these are a few questions that you can ask yourself as you're planning your dissemination strategy. I quite like the model on the right-hand side. And I think if you cover off those 5 items, if you're thinking about the user, the medium, the context, the content, and the source, I think you're on the right track. Obviously, we're looking to spread our interventions as far as we possibly can, and we want population level impact. So some of these questions will be a good starting point. That was a pretty quick intro, I guess. I really want to thank our wonderful partners, all 16 of them, for helping us out so far. My supervisors, the team here who's helped with the Transform Us setup and running, and also my funding. If anyone has any questions, please let me know. That'd be great. Awesome.
All right, we can all turn our videos back on. I think we're into the discussion section.
All right, thank you everyone for sharing your experiences of each of your programs. I'm now going to hand over to Professor Patty Jean Naylor, who's going to direct some questions at our presenters and perhaps give a brief discussion. So if you do have questions that you'd like to ask, please continue to send them through the chat function or the Q&A function, and we'll pick them up as best we can. So over to you, Patty.
Okay, first of all, one of the first questions was, what other implementation frameworks exist beyond those discussed, and some of the pros and cons? This is a big question, but for the panelists, are there other implementation frameworks that you've been looking at?
I think I would, as you said, it's a really big question. And that dissemination implementation website that I shared at the end of my presentation is a really great place to go. You can search through all the different frameworks and see kind of what socio-ecological level that they are at, whether they're more dissemination or implementation. You can kind of see the pros and cons of each of them. And so I would really direct you to that resource. So, and it walks you through kind of how to use it, because there are so many that we could talk about.
Yeah, thank you, Mary. There's another one that was interesting here is, I think it's Shanad Madden asked, how do you ensure all participants had a voice when using a consensus method?
Yeah, so that'll be for the modifications. So we did that in our own internal team, and we held a separate meeting just to code these modifications. So away from our focus on the other evaluation methods, and we got together, and if you had a potential modification to code, you would put that into the top line of the Excel spreadsheet, just a description of it, and then you would present what you would think is the modification. So it might be that there's been some staff turnover, like Sam was alluding to. We've had quite a bit of that, and that was really helpful to track during the modifications. And then we just go through and code, well, actually, is that a modification? And what type of modification is it? Is it fidelity consistent? Is it, and we went through that framework.
Great. And somebody else asked, I might as well, while you're doing a TEPI, why did TEPI focus on modifications to program during delivery/adaptations?
So why did we focus on that?
Yeah.
Yeah, we focused on that because there wasn't too many differences between the pre-scale and this post-scale trial. So in terms of the implementation support provided, they were very similar implementation support strategies. So we assumed that any modifications that would occur would be during the delivery. So what we said we were going to do and what we actually do, are they the same things? And I think we all know that when we're delivering programs, that there are things that adapt from the trial protocol, and there are things that we should be aware of that happen in context. So it's just a way of recording those and putting that into the broader process evaluation, putting that into the fidelity and reach checklists that we're doing, and we're doing multiple other methods and kind of putting it all together in a jigsaw.
Okay, thanks. There is a little bit of a discussion around use of what's the difference with doing an effectiveness trial before or after implementation. And Rachel's represented on here. There's some confusion about dissemination, implementation, scale up. And I think I'm just going to say one of the things this workshop has been looking at is dissemination would be considered to be more in line with scale up. Implementation is something we measure around, even from pilot to efficacy to effectiveness. And so we've recommended some hybrid designs here, but just to be clear that today was focusing on scaling up and measuring implementation when things are scaled up, although Mary did actually just look at implementation really with REAIM prior to a scale up to look at how things were working. So somebody is actually interested, this is a tough one, in implementation component of REAIM, this might be for Mary, and that of Proctor's implementation outcomes, the similarities and differences.
Yeah, so the best I can answer that is REAIM does allow for some flexibility in the constructs. And really, if you look at the REAIM website, when they talk about implementation, they're talking about the consistency, the costs, the adaptations, which are not really any different than what Proctor's talking about infidelity and acceptability and those kinds of things. So I think, making sure that you're looking at implementation outcomes and making sure that they're really answering, as I said, the questions that are most suitable to your clients, and you're getting the information about implementation that you need. So I think the flexibility within REAIM allows you to adapt some of Proctor's constructs there as well.
Great, thank you. And I have a question for Sam. What process did you use to determine what dissemination messages to use, e.g. teachers more interested in messages about concentration levels being improved?
Yeah, good question. So part of that was asking our partners what's worked in the past, and I guess looking through and seeing which of the dissemination efforts had the biggest spike in registrations after they'd been published. So we saw last week that the Department of Education put out an online sort of e-blast, I guess, and we saw that led to 61 teachers signing up within, I guess, 5 or 6 days. And so then we'd look through and see what kind of language they've used, and I guess alter our dissemination moving forward. We also, like I said, went to a lot of teacher conferences and spoke to them face to face about what they thought was important. We've been doing interviews with our teachers and school leaders who have already signed up to the program in the first year, and we've asked them about what they think is most important and what led to them signing up. So I guess that's sort of the ways we've been doing it. And moving forward, like I said, we're tracking all of these dissemination efforts now with embedded links, and we're able to, I guess, test whether they're effective and which ones are most effective. So I guess it's sort of always ongoing evaluation, and it's live in that sense. So we try and keep learning as we go.
Thank you. I'm just going to check in with Tepi or how we're doing for time.
Yeah, so we're actually out of time.
Okay.
The plan was to make this webinar short and sweet, so we didn't cut too much into everyone's day, but we gave them a really interesting snapshot of different projects that are out there focusing on implementation and dissemination. So I'd like to thank you all for joining us. As I said at the beginning, we'll be sending you a short feedback survey so you can provide any comment or feedback to us. And I'm sure the presenters would be happy to be contacted if you have any further questions about the work that they're doing. So thank you, presenters and Patty, for joining us, and thank you for all the participants for logging in and listening to the webinar. So have a great day, everyone.
Thank you.
Thanks.
Cool.